Hey everyone, how are you doing? My name is Dr. Brandon Rosie. I'm a physical therapist currently residing and practicing in the state of California, more specifically Southern California. I run and manage and operate my own physical therapy practice. At the time of this recording, the practice is Rosie Physiotherapy. In this video, I wanted to talk about something that I've been utilizing in my practice and more or less introduce it in the sense of what it is I'm referring to, and that is diagnostic ultrasound. Now, this is not to be confused with that therapeutic ultrasound where you're putting that modality on a tissue and it's providing a little bit of heat stimulation to those muscles or soft tissue articular structures. Rather, diagnostic ultrasound, which we are utilizing to provide real-time point of care ultrasound so that me as the provider, I can get immediate diagnostic imaging quality and find out what is going wrong with my patients and give an opportunity to show them that what their injuries look like or maybe don't look like so that I can get them to have a better compliance and appreciation for the therapy protocol and progress. Now, I've been utilizing this for the last 6 years or so in my practice. We are able to bill for it appropriately, and it is able to be utilized in all 50 states. I've been utilizing it so successfully that I have started to create my own course because I think all physical therapists at this point, especially those with the DPT, should be able to utilize this. Now, many of the other states are starting to, or not many, but several states are starting to allow things like ordering imaging such as a CT scan or an MRI. This is wonderful news, but if you're like me and you're inpatient and you think it's quite frankly erroneous that we have to wait for these things to pass, this is something that can be utilized in all 50 states right now. This is within each and every one of your practice acts as a physical therapist, and I believe that all of you should be able to have the tools necessary to be able to utilize and implement this in your practice if you so wish to do so. And so what I've done is I've actually created a course to teach other clinicians the ability to do all of this. It is a strictly online course. I'll give a much more overview of the course in another video, but I just wanted to review that the course in general is broken into 3 separate modules. Module 1, we focus on understanding what the core fundamentals and principles of general imaging, ultrasound imaging that is, what it looks like. How do you take an image? How do you scan that image? How do you look for the different tissue types? And then what type of anisotropy or what type of artifacts could exist? Now, again, you might not know what these terms mean yet. That's okay. All of this gets reviewed in Module 1. And the major part, the part that no other course, to my knowledge, provides, is that it goes very extensively into the differential diagnosis, namely in the different tissue types, grading the different tissue types, and then a strong focus on the billing and documentation so that you can bill this to either third-party insurances or if you want to bill this a la carte to your patients or just tack it in as a cash-based service, you are welcome to do each and every one of those. And we talk about how to do those in this course. But going back, Module 1, it focuses on everything we just talked about, but the most important part, in my opinion, is that we focus on all those different tissue types, such as bones, muscles, ligaments, tendons, nerves, blood vessels, and we talk about what a normal sonoanatomy should look like, what a healthy tendon, what a healthy muscle tissue, muscle fibers, what all of those should look like. And then we go forward and we look at what those things look like when there is disease or pathology abound and how to grade the different styles of those diseases and pathologies. This is a very intensive module with a ton of review and a ton of education. Next up, there's modules 2 and 3. Modules 2 and 3 are actually locked, so you do not get access to them until you see Module 1 in its entirety. Module 2 focuses on the upper extremity and the protocol scans, as well as how to document and the documentation templates that go with those. You do not have to use those, of course, but they're there for your benefit. Module 2, upper extremity, is going to focus on the shoulder, the elbow, and then the wrist and hand. Module 3 is going to focus on the hip, the knee, and then the foot and ankle. So what I want to do is I just want to give you a brief overview of what that does look like. Now here, I've got it in an admin mode. Right now, there's it's just showing 0 of 23 lessons completed. And I do want to make this very clear. I add lessons all of the time. And this is, in my opinion, this will always be a work in progress because there will always be new information added all the time. But going through, here's module 1, again, the core fundamentals and principles. And we are going to discuss, in this, we discuss the basic principles, and I immediately jump in how to add it to your practice, how to begin billing for this appropriately and legally to third-party insurances. And then we go through, I'm going to redo some of these videos, just breaking them into smaller chunks because this is around 17 hours of video in just module 1 alone. And I want to break it up so that you have an opportunity to review these in smaller chunks if you just don't have that much time set aside for each one. And then going through again, here we talk about the bursa, peripheral nerves, blood vessels, bones, and then the artifacts. And then once you advance, again, module 1 is only open, and then module 2 and 3 is locked until you complete all of module 1. Now, I know that that seems frustrating at first, but once you get through of all of that foundational information, the rest of it will really pay dividends as you go through it. Module 2 focuses once more on the upper extremity. Again, shoulder and arm lecture. This is where we focus on what the images would look like, and then we go through the shoulder and upper arm ultrasound protocol, and then we go through again the elbow, the wrist and hand, and then the documentation template. And then module 3, the same thing with the knee, the foot and ankle, and I'm actually about to re-add the hip, which is why you do not see the hips there at all. Just to give you a quick overview of what this does look like. So let's just skip ahead, and it's showing about how to find some of these images and what it is that those exact images would look like in real time. And then next up over here, we can see how I do the exact in-person protocol exam on a patient in real time so that we can see and appreciate those tissues going through the standardized protocol first, and then once, if you find pathology, and then how to hone in on that and get a little more specified view. Okay, so that is just a brief overview of what the course looks like. Again, that is just the beginning. We are going to be adding more modules and more information all the time. If you are interested in the course, feel free to reach out, send us an email, or you can look at the link in the comment down below. Thank you so much, and I'll catch you all in the next one.